What is monkeypox? Member of the orthopox virus family that includes smallpox, that many of us are familiar with, and orthopox, and several other animal pox viruses. So it's in that family. Viruses like this are unpredictable, so we really don't know what's going to happen. On the other hand, the best course of action for now is to be on the alert. And that's the advice that I would give to my patients, to my friends, and to my medical colleagues, is be on the lookout. The big feature is a rash. And with this current outbreak that we've seen, the rashes tend to be in the groin, around the rectum, on the trunk of the body, hands, face. Either one small lesion spot or several of them together. The other thing that happens with monkeypox infection is that people do get sick. They may have fevers, fatigue, muscle aches, and lymphadenopathy or swollen glands in either the neck or the groin. It takes about 2 weeks for the infection to resolve. It is what we call self-limiting. In other words, it sort of takes care of itself because there really isn't any specific treatment for this virus. So patients wait it out. The other thing that happens with this is you are isolated for about 2 weeks. That we certainly need to notify public health people of this because it's unusual. I mean, you have to do that because we're trying to stop the spread. That so far, we've not seen any hospitalizations or deaths as a result of these infections. It spreads with close contact, intimate contact, skin-to-skin contact, the kind of contact you have when you have sex. That there's a lot of rubbing of skin, and these lesions, as you see in the photos, the wet early lesions have virus in them. So with skin-to-skin contact that takes place, and I'm using sexual contact as the example here, is you rub it on the skin of somebody else, maybe abrade the skin a little bit, and it sets up housekeeping in this other person. So it's person to person, close contact, skin contact. I want to avoid stigmatizing people here. And that's been a big focus of the discussion. How do you get the message out in ways that are meaningful and understandable to people without stigmatizing another group of people? So we talk about populations who may travel to large events where partying and sexual behavior are part of the event and then bring that infection back. Meeting people on social media apps and having sexual contact with people who you're not familiar with. Or traveling to a country where monkeypox virus has been identified. So as of the moment, a large percentage of the people reported with this infection are men who have sex with men. But as we've seen in past pandemics, when things are transmitted by sexual contact, then people who have sex are at risk here. My take on all of this is we need to wait and see here, because this appears to be very early in the course of this outbreak, and we have to see what's going to happen before we can say one way or the other that it's one group or another. But I'll tell you one thing, I'm certainly letting my LGBT patients know, my patients who are men who have sex with men know what to look out for.